Thank you. Senator Klobuchar and Senator Cortez Masto, Whip Clark, and Rep. Dingell in her absence, and the other members who are here. Thank you so much for convening this hearing or forum. Thank you for inviting me to appear on behalf of the National Partnership for Women and Families. And I appreciate the opportunity just to talk about the real harms posed by the bill that's currently pending before the Senate. The bill would fund enormous tax cuts by stripping away protections that are critical to the health and well-being of millions of families across the country. I'm going to focus on really the harms to women who are really going to bear the brunt of this bill. And I'll say at the outset that we know that women are the backbone and often the linchpin in their families. They're the ones who control, oversee, direct the care in their families. They're the ones who are focused on the overall well-being of their households. The reconciliation bill has what amounts to cuts in Medicaid, Medicare, and the ACA marketplaces, all of which are vital to women's health. There's an estimated 24 million women who participate in Medicaid. 1/3 of them are mothers. More than half of them, nearly 13 million, are women of color. The measures included in the bill would result in people being cut from Medicaid, and that'd be devastating for all of those women at every juncture of their lives. And I'm going to talk a little bit about that. First, from just a reproductive health standpoint, the House bill would make it harder for women to control their own bodies. We all know that's a design, and really to determine whether or not, when and if they have children. It would leave a little over 1 million without access to birth control, abortion, other forms of reproductive health care, through a provision that's intended quite intentionally to defund Planned Parenthood and close up to 200 clinics across the country. For women who do become pregnant, Medicaid is the nation's largest payer of maternal health. It covers 2 out of every 5 babies born in this country. In some states, as you well know, it is higher in a majority. And the funding cuts would jeopardize the health insurance and safety of more than 13 million women of reproductive health age, risking deepening a crisis that we already have around maternal health. And if you look at the numbers for Black women, Black moms, and Latinas, those numbers are even higher in terms of how much Medicaid funds in terms of the number of babies born. This bill also hurts women who are raising families. Nearly 8 million moms and 37 million kids are covered under Medicaid. In fact, in past years, if you look at the data over time, roughly about 75% of the folks who are on Medicaid are adult women and children. So these cuts have enormous effect. Some of the folks who have advocated the House bill, as you well know, have employed what I think can only be characterized as a really demeaning narrative about folks who receive Medicaid, to question their work ethic, argue that people don't deserve it or they don't need it. This narrative, it's disrespectful, it's dishonest, and it's disconnected from reality. The vast majority of Medicaid recipients, most mothers on Medicaid, already work. Among those who don't work, of which is a small percentage, only a small percentage of those are considered able to work. Many of those folks are older women. They're people who either have disability themselves, they've dropped out of the workforce, or they're caring for somebody. Imposing work requirements on these folks often does not increase the number of recipients who are working. What it really does, because of the onerous burdens in terms of paperwork and confusion, is that it just leaves people to lose their coverage entirely. Our other witness already spoke about, Medicaid and SNAP provide an essential infrastructure for families. The loss of these supports would be devastating. They're also unprecedented. And I have to say, the bill does really little to invest in people and working people. And we know that moms increasingly are critical to the economic stability of their families. For example, millions of people need access to things like paid leave, including moms. And what we find is that instead of having real paid leave, there's a tax credit in this bill that just gives money to companies That makes no sense. So we're really incredibly pleased that you are holding this conversation. The National Partnership is more than willing to work with all of you to really hold the line and really do right by women and families in this country. Thank you.